All right, so hey everybody, and welcome to our presentation. I'm Dr. Meagan Jones, and I'm really excited to bring you this presentation today. It's entitled Authentic Sexuality After Sexual Trauma, and this is a topic that I've dealt with for many years in my professional practice. It's also an area of specialization for me. So I've done lots of research and other things surrounding this topic. So I want to let you all know that because there's a huge amount of information that we cover relating to this topic, and there's just a huge amount of information out there on this topic. And of course, we have our 1 hour time limit. So this presentation is mostly going to focus on the cisgender female population, and it might be a bit more generalized than our research will be. But this is still the highest reporting group of sexual assault survivors, so even though we know that those numbers are probably not as accurate because of underreporting in other groups, we're hoping to take this research further. And so in our further research, we will include more information on other groups that are underreporting. So I want to take a moment before we start and just let you all know that the information that we're presenting today is about sexual trauma. So it can be triggering. We will be including some information from real life clients. So there may be some graphic content as well. So please feel free to leave or mute the presentation if you need to care for yourself. Also, if you have like small children or others around you that you do not want to hear any type of sexual content, then I would suggest either wearing a headset or leaving them in someone else's care or something. So we're of course going to address these things scientifically and professionally. However, it is the content is sexual in nature. So I have two great presenters with me today, and they're going to introduce themselves. So go ahead, Sarah. Oops.
It would help if I unmuted myself. My name is Sarah Crouse, and I am a current clinical mental health counseling student here at the Chicago School. I received my first master's degree here as well, which was in psychology and a focus on children and adolescents and trauma and crisis. I guess I liked it so much that I decided to then continue my education and join this licensure track. I will begin my fieldwork here in just a couple of weeks at my current place of employment, which is just a small private practice here in Ankeny, Iowa. And my areas of interest include trauma, of course, children, adolescents, and new mothers. I also have a really special place in my heart for holistic and alternative healing. I've completed a lot of research in this area and presented on it just because I'm passionate both in my personal life and my professional life. So that's a little bit about me.
And my name is Michaela Detrick. I am also a master's student in clinical mental health counseling here on the online program. And I'm a candidate in 2 weeks. I'll be done. No, next week, sorry. So I'm very excited about that. I am also a Pennsylvania certified addictions counselor, and I've been working in inpatient detox as a substance use counselor for about 5 years. I, through my field work, have been doing outpatient trauma yoga and co-facilitating those groups. I've been able to lead a few on my own with another therapist with me. This month I started a new position as a part-time mobile therapist in BSc with a private practice. And currently for my field work, actually on top of outpatient trauma yoga, I work as an intern in the college counseling services in an undergraduate campus. So I mainly see students right now for my clients. And I do have interest in adverse childhood experiences and the ACE studies, trauma, addiction, and creative therapies.
So I just realized that I forgot to introduce myself really and talk about that. So I'll just go back real quick and do that. So again, Dr. Meagan Jones, I'm an adjunct professor here in the online program. And I have a private practice in North Carolina and Virginia. And then I also have done some research work and authored a few things on counseling like LGBTQ and teens. I've worked in with sex trafficking and trauma, and of course, sexual abuse is one of my passions as well. So I don't have a lot of free time, but when I do, I like to do crafting, be outdoors, reading, cooking, and spending time with my family. So that's me. So I want to do a little introduction of this topic, just by talking about why we would address a topic like this. So the topic of sexual trauma and achieving authentic sexuality after sexual trauma is definitely a passion area for me. I've been working with survivors of sexual assault for most of my career, and this sort of became a passion of mine when I started working in the correctional system. There was an extremely high and disproportionate number of the women that were incarcerated that had been sexually assaulted. So that's sort of where the passion began. And as you can see from the slide, where it says, you know, in the US, 1 in 3 women and 1 in 6 men have experienced some form of contact sexual violence in their lifetime. That's just contact sexual violence, and that's just what's been reported, which we know there's a large number of people that don't report. So this is a really widespread topic. This is something that happens to a lot of people, and I think it's valuable to keep revisiting it. So as I said before, that, you know, we have this huge number of people that have been sexually assaulted. And as you probably know, there are significant effects from this, significant long-term effects. So what do we do with this? In my career, I've encountered many survivors of sexual assault that have had difficulties with their sexuality going forward, in a lot of different contexts as well. So for this research, it sort of sprung out of that, encountering those people that sort of needed help with this, sort of, I guess after we had gone through some of the trauma counseling and we had worked through some of that, there was still this like, well, but I'm not really happy in my sex life, or I'm having problems in my marriage, you know, what do I do? And so I had focused so much on the trauma that I didn't realize that there was still these long-term effects that needed to be addressed as well with their sexuality. So this research began about 7 years ago when I had several clients at the time, female survivors of sexual abuse, that were asking me for help with sexuality after trauma. So I began to research, and I realized how important it was, and understanding the need for good information, which at that time there was definitely a scarcity of. I think we're coming more full circle on this, but there's still a need for it. I also was introduced to the concept of authentic sexuality at that time, and we're going to discuss that a little more later. So this research sort of began as a series of seminars, of support and psychoed groups that I did, and they were for female survivors of sexual assault, and they were called Restoring Stolen Pleasure. I had a really overwhelming response to these groups, and they were received very good feedback, seemed to be pretty successful. And so that need for this, the need to talk about this, was just reinforced by that. And not just talking about navigating the sexuality, but also talking about the trauma, and also, you know, what do I do now? Where do I go in my life? So some of the questions that these survivors asked were like, how do I engage in sex life that's fulfilling when all these things have been taken away from me? What do I do now that I'm not having flashbacks all the time, but I still have flashbacks when someone tries to touch me? Or, you know, how can I enjoy my marriage and enjoy the sexual part of my marriage when I don't really like sex? So there were just all these questions and just different things that they brought to the groups, and I think that they got a lot out of being able to talk about it with other survivors, and just sort of that back and forth, I think, really helped them. So I found that a lot of them, in an effort to feel good and normal again, the survivors were being re-victimized because they were sort of going about things the wrong way. And there was a potential for depression there as well. So I started to integrate the authentic sexuality and what that means. So this is a term that's coined by Balswick and Balswick, and it just means that the survivor works to discover their most fulfilling version of sexuality. And we're going to discuss this a little more in depth in some of the next slides, but I just wanted to kind of lay the groundwork for it now. So, all right, we can move on then.
Yeah, so one of the first things that we wanted to talk about in this presentation is sexual education and why it's so important to provide that as a mental health provider. It's vital to understand that clients have a very diverse background in their sexual education. And what I mean by this is that it can come from many different areas, their schools, their parents, their peers. And with survivors of sexual trauma, oftentimes their abuser is the one who educates them on their sexuality and sexual experiences. So this is why it's so important to have a strong foundation for discussing just basic anatomy, sexuality, and the context in which sex happens. So much of the research that I was absorbing brought up the point that sexual education in the school system is often done in group settings, which makes it quite difficult for really any child or a child who's experienced sexual trauma especially to really ask questions or share their insights or their emotions about it, just because it's in that kind of awkward group setting. The way that they introduce the information too can be quite negative. So they talk about, you know, abstinence and avoiding STIs, pregnancy, and not engaging in any sexual activity at a young age. So someone who has been through sexual trauma may internalize that and feel as if they are unworthy or less than or even dirty. They might feel like all forms of their own sexuality is quote unquote wrong. And then another perspective that is important to think about with this population is individuals who have survived trauma may have learned from their abuser. So that abuser may have taught them kind of what sex should look like, what should bring them pleasure, or what is appropriate. And an example of that is maybe a young girl who has come to counseling with you and she was abused when she was really young, and her abuser may have taught her that only oral sex is the only sex that she knows, and he has taught her that that is supposed to bring her pleasure and supposed to be, you know, the only thing that she engages in. It's not reciprocated, she doesn't really enjoy it, but that's what she's taught to do. So essentially, when you're working with her, you need to start over with her self-discovery and the education and the exploration. So just understanding the role that providers play in the trauma-focused sexual education It opens up the doors for the client to feel safe and begin the process of finding that true, authentic sexuality. Okay, so that transitions into incorporating the conversation in session with a client. And the best thing to remember in session is to just avoid inserting your own emotion or judgment into the conversation. And this will allow the client to feel as if they can open up and talk to you and ask honest questions. So when I was doing my research, I found a really cool tool that you can utilize in session with clients who have experienced sexual trauma. And it comes from a therapist named Joanne. I'm not sure how to pronounce her name, but I think it's Schlaudale. She introduced this 5 senses approach, and the purpose is to kind of explore all 5 senses with the client to determine what brings them joy and pleasure and what may bring them negative feelings or may be triggering for them. So when thinking of using this in kind of like my own sessions, I envision utilizing like a worksheet with a symbol for each of the 5 senses where either I or the client takes notes throughout the conversation. And for example, a client could talk about things that are like visually pleasing to them, and I could write them down on a category. And in the end, the client has a well thought out list to help them kind of learn their own boundaries for their self-development and exploration. And the whole purpose of this is to just empower the client to know that they are able to tend to their own wants and needs and to know what's triggering. So it gives them a good sense of a safe space to kind of explore.
And as counselors, we can face pretty much a range of any target concerns with our clients that can actually benefit from being able to address authentic sexuality in therapy. And the term authentic sexuality is fairly nuanced. It has a whole different meaning than some original decades old research. But no, it doesn't mean, hey, forget protection. This anything and everything goes perspective actually deprives individuals of the clarity and vision on how to find authenticity in their sexuality. So societal structures, attitudes, and just our cultural beliefs, they can create these unrealistic, false, convoluted, unreliable messages about sexual behavior. And we can steer away from authentic sexuality as this anything and everything view. That can be ruled out because sex should always be consensual, it should always be non-damaging, and it should always be pleasurable and fulfilling to the individual. As opposed to authenticity as in honesty, we're looking to address the lines created by labeling sexuality as either good or bad, functional, dysfunctional, or healthy or unhealthy. Authenticity leads to this deconstructing of the dichotomy of sexual behavior, and it allows our clients to feel free, feel genuine, feel unburdened by shame or guilt, which affirms our sexuality to be an integral part of our total being. So authenticity is real, it's genuine, it's believable, it's trustworthy. Authentic sexuality relates to the awareness and expression of our authentic selves. It's who we really are and what we really want. It's learning how to speak our truth. And shame is something that clouds authenticity. And shame can be created through cognitive distortions, and actually at times it is a cognitive distortion. It harnesses these negative beliefs that we have about ourselves, about our actions, about our experiences, and about who we are. So as developing counselors, which many of us can relate to, we strive personally for authenticity with our clients. Why? Like, why do we need to be genuine and authentic in counseling sessions with our clients? And Rogers, we all know this through our studies, Rogers found that something amazing happened when a counselor combined this self-awareness, empathy, and faith in their clients. And what happens was it broke down all of these barriers and it modeled a real relationship for clients. So we need authenticity to build meaningful connections and relationships in our life. And otherwise, these relationships are not built on stable, deep foundations, and sometimes they can't grow because inauthenticity is incongruence and it's a distortion. So we look at intimate relationships, we can see the importance of authenticity and sexuality. And this can be communication, self-awareness, self-entitlement, and assertiveness. So I'm going to take a look at each of these components in the frame of a sexual relationship. With communication, a sexual relationship involves more than one person, and in a traditional or typical sense, two people. So let's assume you and your partner. Communication is what's vital to expressing your needs and also understanding your partner's needs. So we're able to give and receive consent on an ongoing basis and do more or less of something based on preference and based on desire. Self-awareness, learning to love ourselves, what we truly want, learning how to be yourself and express yourself. Self-entitlement, learning how to balance pleasing yourself and pleasing your partner. Being okay with saying no. And through self-entitlement, individuals can experience autonomy rather than victimization or terror, or actually feeling the need to negotiate things. And assertiveness is the ability to effectively express your wants and your needs. So we use each of these terms and nuance to better understand healthy sexuality versus authentic sexuality, and then tailor each individual's experience and healing. Sexuality also looks very different post-trauma. I currently intern in college counseling, and I work with students who have experienced sexual assault on campus. And these students, their experiences, they're all very different, but collectively they typically experience a difficult time saying no to sex. And that's because they're either not sure of what they're supposed to say, they question if they actually do want sex, or if they're just afraid of saying no, if they're actually disinterested, and maybe that disinterest is a symptom of the trauma they've experienced, and they just want to feel normal, so they have sex anyways. I have one student who sits in the shower for hours after sex because she just is unable to feel clean. And I have another student who is afraid to actually say what she wants for fear of not pleasuring her partner. And all of these put them in very difficult situations. Facilitating sexual healing mainly deals with addressing the cognitive response post-trauma. And sexuality becomes so linked with shame, with guilt, self-blaming, and this distorted view of control over events that have happened and even over recovery. And as I mentioned earlier, shame is what clouds our authenticity. So shame can be created through these cognitive distortions. It is a cognitive distortion. It harnesses these negative beliefs about ourselves, what's happened, who we are. You know, we believe a bad thing happened, so I must be bad, or I did something for this to happen. I'm not the same. I'll never be the same. And to keep from feeling this overwhelming shame and guilt and blame, the feelings are suppressed. And then the individual is not able to access or authentically feel their own erotic feelings. So normal is not the goal. It's addressing all of this underlying things and putting these pieces together. So clients come to counseling at all different stages in their journey. And characteristically, our clients may be trying to go on with a normal life, their job. They may be a student in school, they have kids, they set professional and personal goals, yet there's still another part of them that is still activated by this trauma-related stimuli. It's that animal defense of fight, flight, or freeze, or cling, or attach. And it results in this hypervigilance, this mistrust, overwhelming emotions, debilitating depression, anxiety, self-destructive behaviors, fear, hopelessness about the future, and all of these things are why our clients actually come to counseling in the first place. So first and foremost in trauma counseling, we establish safety for our clients, we create a trusting relationship, and then we address these high-risk behaviors, the self-harm, injury, substance use, restricting, binging, purging, which all of those things do serve a purpose. You know, individuals indulge because they're trying to modulate this dysregulated nervous system and prepare themselves implicitly, subconsciously prepare themselves for the next threat. Like all of these things either increase your adrenaline or increase arousal, or they emotionally numb. And then we can address these risks first for safety reasons and then address the trauma. So we help them find relief in their symptoms, addressing symptoms of post-traumatic stress disorder, helping our clients to find self-empowerment and self-entitlement to facilitate sexual healing, and to be able to identify within themselves a sexual being with real desires, and being able to attach to that part of themselves that they may feel detached or fragmented from. And this is all titrated. I forget the reference for this, but I've heard the slower you go, the faster you get there, because we don't want to risk re-victimizing our clients. Something near and dear to my heart is creative therapies. And so our aim is to put these fragmented pieces back together. And creative therapies are used to allow clients to express what they may not actually have words for, and sometimes they implicitly believe or perceive things without actually realizing it or being able to, bring that out. So for me, I think yoga is an incredibly helpful therapy tool, and it creates and develops this mind-body connection. So I co-facilitate trauma yoga groups in outpatient, and what we do is we work to develop attachment and connection within ourselves as well as with other people. So we use stretches and poses and flows to evoke power, physical power, control, courage. We have used guided imagery to explore flashbacks with clients, which has been very interesting. And all of our groups are very heavily screened for appropriateness. But one guided imagery that we used was to imagine that everybody closes their eyes, and what you see is watching your experience on a television, like third person, and the volume is off, you're just watching, and you can pick up the remote and turn it off whenever you want to. And you have the power, you have the control to turn off your flashbacks, mute them, fast forward, and we basically sit there, and in the guided imagery, we play around with the remote control and we take over what's going on. So allowing yourself to just be with yourself sometimes, no judgment, just observation in yoga. Individuals who have experienced sexual trauma may not feel that this is their body. It doesn't match, it doesn't feel authentic. So it's reconnecting individuals with their physical body. In using breathing and breath techniques, what you do feel physically and emotionally, you can watch how you have control of both, and you can influence your physical body and your emotions with your breathing. So some additional creative therapies to use are guided imagery, along with yoga, meditation, music, therapy techniques, sand play, mindfulness, dance, holistic healing, art. All of these are great ways to get aside from just the talk and give clients sometimes just an expressive outlet. So Mythbusters, some common misconceptions. This is not necessarily like a true or false portion of things. I think that just true and false can lead to so many misconceptions in itself. So we just want to provide a little bit of a deeper insight into these ingrained beliefs that sometimes society and cultures have about sexuality. So the first one is that men have a higher sex drive. They want sex all the time, and they sexualize everything. Does anybody have any comments or insight to that?
It's certainly a conception that exists in society, but a myth.
Yes.
I think,
go ahead.
I think some cultures, I just know, like on the Hispanic channel, it's always women in like bikinis and stuff like that. It's never men in that way. And so it just always kind of makes it seem, that's how women should be presented, because that's what men like to see, type of thing. So
Yeah, and Ruth has a comment in here. She said, I grew up as men being weak when it comes to sex. It's not their fault to cheat. I think that goes right along with this. And actually, in some things that I was reading through, about a fourth of the time women display a higher sex drive than their male partner. And I think this is so important because in relationships, women tend to really feel like something's wrong if their partner's disinterested or if he has a lower sex drive. And without this validation through sex for women, sometimes they experience this crushing neglect, rejection, abandonment. And I think it really plays into the stereotype of female passivity, which also can really lead to victimization. And the second one is sexting. Sending pictures, messages, or videos is harmless because you are not face to face.
That's a myth because people then can send those pictures on to other people. And there was actually a situation at the local high school where a girl sent a picture to a boy and then he shared it to all of his friends. And then he told his friends they couldn't look at it until they paid him $5. So it just led to this whole situation. And the girl actually transferred out of the school because of the situation.
Wow.
Yeah, I think it can lead to, a complete re-victimization if an individual, a girl meets someone and puts enough trust in them to send them a picture thinking that it's harmless, and then that is shared or otherwise, shown to someone that she didn't want to see it, that can totally re-traumatize the individual and further perpetuate the trust issues and the trauma.
This actually brings up something that I feel like I've been hearing more and more lately with people around my age, late 20s, early 30s, of women, and this is because I'm mostly speaking with women, receiving unsolicited pictures from men, and and how irritated and how violated that they feel because they just get a text message and it could be from a friend or something, and they're not expecting to open it up and be able to see genitalia, and so that it can be horrifying. It can cause a sense of violation as well, just receiving it.
Total violation. And being an intern on a college campus, we actually have a Green Dot initiative going on, which is more awareness of bystander intervention and sexual assault on campus. So it's always important to remember that consent is required constantly. Like you mentioned, Grace, like messages can be unsolicited sometimes, pictures, and that's harassment. So it might feel brave to be behind a screen, but everyone's responsible for the boundaries and even the potential harm as they would be in person too. The next one is masturbation. It means that you're lonely and you're perverted.
Myth.
I'll give you a hint. All of these are pretty much myths. But there's so much shame and there's very harmful stigma attached to masturbation. And I think that a lot of this is cultural views, especially because those are very strong on this. But and masturbation, regardless of views, it doesn't cause physical or mental illness, as actually some myths do say that it makes you mentally ill.
It makes you go blind, I heard.
That might be true. No, I'm kidding. It's not. That's not true.
I've actually heard a lot more talk about masturbation is acceptable for men to participate in, but girls should be ashamed to do something like that. And I, obviously that's incorrect as well, but that's often said out there. Also going to a Catholic high school, my sex ed that I received in high school was, it is a sin to masturbate. I'm not Catholic myself, but if I can remember correctly, they were saying sex is supposed to be for procreation purposes only, and if you are masturbating, you're sinning because you're using your seed for something besides procreation, which is weird.
That's right on par with my experiences with friends and family who share those beliefs. And how horrifying for women that they're labeled as dirty for, engaging when, well, anyways. The next one is, if you are assaulted by someone of the same gender, you will definitely be homosexual.
That's a myth.
This actually circulated for quite a while, that homosexual men are products of child molestation and sexual abuse. And even though sexual abuse might impact erotic interests, it's not the same as orientation. They're very different. And exploration is common for individuals who have disorienting early experiences, but that does not make someone gay.
Ruth said that she worked at a high school recently and that many of the students there believe that, and I've seen that with clients myself in the drug and alcohol rehab environment. We know that there's a lot of sexual trauma there, and I have heard homosexual clients say, well, this happened and maybe that's why I'm gay. And I'm like, oh, let's look at this a little further. That does not cause sexual orientation. Like you said, it can affect, what was the word you used, arousability?
Erotic interest.
Erotic interest.
Yeah, and how horrible for an individual to believe that that's why they are the way they are. That's what makes their identity now.
I also work at a chemical dependency unit, and we have a person come in once a month and talk about like sexual trauma and things like that with patients. And one patient blurted out that men can't be sexually abused. And it just, like, people are so unaware of these myths.
Oh, totally. And they just keep circulating too. I mean, you can Google and find some random article that, has this stuff still going out there. And the last one is, if I have fantasies about the way that I was assaulted, that means that I am sick or crazy. Dr. Go ahead, Jen.
No, I was going to say it's kind of just like the last one, that it's a myth that unfortunately a lot of people might believe, both survivors and the general public, but just the fact that someone has an erotic interest does not, mean that it was that's related, that it makes them sick or it makes them change their orientation or otherwise.
This is actually fairly common. And for instance, with rape survivors, it's common for them to have rape fantasies. And rape is an act of violence. It's not a sexual act. So having fantasies or being turned on by the idea of being overcome or taken, it's very different from what you ask for in the, quotations, real world. And actually 62% of women report to having rape fantasies, and some of them have had experiences with that. So it's not uncommon, and it doesn't make our clients sick or crazy.
I was going to say, just on that, just from a male perspective, with a lot of men, I think there's a lot of self-hatred that sometimes does occur with them because of perhaps when you talk about like the idea that many rape victims fantasize about the experience, it causes a lot of men, of course, to just kind of go down a very, you know, anybody who encounters some rape in general, just those emotions can really kind of mess them up, because there's that pleasure at the same time, and like there's a certain torture to it as well, that kind of, especially, yeah.
Yeah, and actually it gets a little Freudian, so I'm not going to get into that with some theories, but it gets to be like, you know, an individual must be consumed by self-loathing and guilt and shame if that's what their fantasy and their experience has been. So it gets very interesting sometimes.
So another area that we wanted to kind of touch base on in this presentation is considerations of special populations. And I put a lot of thought into thinking about what populations could I possibly fit on 1 or 2 slides for this presentation. And there's a lot of research out there and a lot of different ones that I could have chosen. I decided to go with these 2, individuals with intellectual disabilities and individuals with physical disabilities, specifically for this topic because there is a lot of complexity that comes with individuals with these disabilities, and kind of understanding who they are and the experiences that they've had. So they also, you know, may have trouble learning about their body and learning how to explore their sexuality in a safe manner. So starting with individuals with intellectual disabilities, they may have or have had a partner who is abusive, but they may not have the capacity to understand the difference between a consenting relationship and an abusive relationship. So this is why it's so important in session to discuss the context in which sex happens and also how to communicate their needs well with partners. It can be really challenging for this population to communicate just because they may not have strong communication skills, and they also may struggle regulating their emotions. So they might get really mad about talking about it. They might not want to stay in session with you if you make them upset. They might get really teary, and you might not want to continue talking about the topic, and it can just get difficult to work with. It's also important for providers to really address safety with clients with intellectual disabilities. For example, there's a client that may need reminders about the consequences of unsafe sex practices and why safe sex is important. The conversation may seem redundant, but it's highly beneficial to reiterate, especially when they are trying to explore their own sexuality. So moving to individuals with physical disabilities. I felt kind of silly when I was doing research about this. I kind of read something that clicked with me, and it's not really something I've thought about before. And I think maybe it's just because I'm still kind of new to the counseling field. But it brought up the point that someone with a physical disability may really struggle to determine ways to seek pleasure because of their disability. So for example, they may have lost feeling in part of their body, or they might be paralyzed from like the waist down. And it can really bring physical challenges to their self-exploration process and also exploration with partners. So this can cause a lot of feelings of lack of self-empowerment that you can work with in therapy to try to build up.
Okay, so I wanted to move into sort of an interactive part of our presentation. And so I'm going to present a case study. This comes from a real life client, so just a warning that this might get a little graphic. Again, please care for yourself as needed. I'm actually going to stop sharing my screen so that I can see you and see the chat box too. Okay, so our case is Laura. She is a 42-year-old straight biracial, biracial meaning African American and Caucasian, cisgender female. She's come to counseling for help in her marriage and help with anxiety. She's been experiencing a lot of discontent in her marriage and a lot of fighting and arguments between her and her husband. She said that she wanted to do couples therapy, but her husband was not willing to come at this point because he thinks the problem is mainly with her. She describes her anxiety as coming in spurts, and it happens mostly when she thinks about her husband leaving her or having to be intimate with her husband. She says that most of the time she's fine, but she does feel depressed sometimes. So a little bit of background on her. She was sexually abused by her mother's boyfriend from the age of 11 to 14. He mostly forced her to watch pornography with him while watching him masturbate and perform oral sex on him. He did not vaginally violate her or anything like that. It was mostly oral sex and the pornography. Her first sexual experience happened when, or outside of the abuse, happened when she was 13 years old. She was sexually assaulted by her cousin's boyfriend, who was 20 years old at the time. He sodomized her and performed oral sex on her, and this was one encounter. She said this was probably her most confusing and defining experience because she had never been aroused before, but she became aroused during this experience despite not wanting the attention. When she told her mother about both of the assaults, she told her actually at the same time about both of the assaults. Her mother became really angry with her and said that it was her fault because she was alone with them. But her mother did end the relationship with the boyfriend. So he was removed from her life at that point. From here, Laura began using drugs and she started acting out really severely. She was sent to a group home for girls when she was 16. Once she was 18, she moved out and continued to use drugs. During that time, she was sexually assaulted several times, she says. She said that she didn't really remember all of them because they happened when she was high and she really didn't care about what happened to her. She also had a few abusive relationships during this time that she says were pretty traumatic for her. When Laura was in her early 30s, she decided to go to rehab and clean up her life. So she broke up with an abusive boyfriend and got married rather quickly after that to her current husband, who she describes as a bit controlling, but really good to me. Since getting married, she and her husband have struggled with alcohol abuse off and on. She came to counseling saying that her husband is really frustrated with her because she's not responding to him sexually the way he desires. She says with a lot of shame and embarrassment that she can't get aroused by sex with her husband, and that she really doesn't understand or get much out of vaginal intercourse. She says that when she is intimate with her husband, she experiences a lot of disturbing images and flashbacks to her assaults. And instead of feeling good, she says that she'll just lay there until it's over. Her only sexual pleasure comes from watching pornography that's typically violent in nature and masturbating. And she says that her husband liked this at first, but now he calls her disgusting when she does it. She says that she desperately wants to please her husband, and her worst fear is that he's going to leave her because she can't measure up. So let's discuss this case a little bit. tell me what your first impressions are of Laura.
One of my first things is her support system. She doesn't really have one, which is why it seemed like she went down the path she did, because she didn't have that full support from her mom. And then she sought out things to help her cope.
Definitely. Other impressions?
In the chat, Ruth said the same thing, and she said, "I feel so bad." So, like, you know, sympathy, feeling bad for her, which I agree with.
Yeah. It's a pretty intense one, but not out of the ordinary for this population. So in thinking through what we've talked about in the presentation, and thinking through Laura's case, how do you think that she might respond, or how do you think that the concept of authentic sexuality might help her?
I think she needs to rediscover who she is and find things that work for her. Not necessarily like sexual wise, but what makes her feel beautiful, what makes her feel like a woman, to kind of help break the cycle that she's in.
I agree. I also was thinking about how from an early age she was learning how to please other people, that she hasn't really found her own way of accepting herself. So
Yeah, definitely.
for that.
Yeah, to build off that, I was going to say like self-esteem would be a good thing to process. I have this activity where I break down self-esteem into like 10 different categories, where it's like self-love, self-guidance, self-determination. And so they can kind of see that self-esteem is more than just if you like yourself, and just kind of see like, or even self-feeling, you know, for her, she's so used to kind of being a puppet for everybody else. But how would life be if she was, you know, her own puppet master? You know, take that approach where she leads her life in the next step.
Definitely. Thank you, Alexa.
For me, or my opinion of her is, I feel like there's a problem with trust. I personally am too new in the program to really understand the utilization of it, but kind of going back to, you know, attachment theories of her trust system and trust base has been destroyed. Her mom, who was, you know, her primary caregiver, kind of blamed her for what she did. Now she's in a position, the people that she's dated have treated her poorly. And now she's in a relationship that she's worried that if she doesn't please him sexually, he's going to leave her. So she's not trusting in their relationship and their foundation. And from my understanding, trust or a lack thereof can greatly impact one's sexual functioning and ability to even experience or enjoy the act at all.
Yeah, I think that she doesn't trust her sexuality as well. What kind of relationship she has with it. She doesn't.
Definitely. Yeah.
I also think it would be good to explore her feelings of shame and guilt, because just the fact that her husband's telling her she's disgusting, and I feel like she probably has a lot of feelings of shame.
There's just a couple things in the chat that the mindfulness would help with self-identity. And Tina says to build off of Danielle's statement that now she's trying to satisfy herself and her husband is telling her that she's disgusting. So it's just like she can't please anybody.
Right. Yeah, so in the interest of time, I'll kind of wrap this up and tell you sort of some of her outcomes. So this was a real client, is a real client. I guess she's still around. She's doing much better now. We worked on authentic sexuality. We worked on self-esteem, finding her voice. And so she made some significant strides with that. And actually, she ended up getting rid of the husband, which was sort of a mixed thing for her. I mean, of course, it was a sad thing, but also I think it gave her a lot of freedom, and it actually didn't have anything to do with this. He was unfaithful to her. So she ended up divorcing that man and entering into a new relationship after about 2 years being single, which was huge for her. She had not been single for a long time. And so for her, that was sort of her way of finding her voice and figuring out who she was. And then she ended up getting married again. And I still get updates from her sometimes, and she says she's doing really well. So this was a happy ending case. They're not all that way, but I wanted to give you guys a positive one. So we only have like 3 minutes left, but are there any questions for us or any comments on the presentation?
Comment that this was fabulous. Very well done, very well researched, very compassionately presented when you're especially talking about a really difficult subject. I think you all handled it very well. Thank you.
Thank you.
I agree. I think you all did a really great job with this. I learned a lot. Thank you.
In the chat box, Ruth said, great job. I learned a ton. Thank you. Tina said, very informative. Thank you.
Well, thank you all, and especially thank you to Sarah and Michaela. They did an amazing job and have definitely learned a lot and helped a lot with this topic. So I guess we can finish up then.
And this
All right,
was
goodbye.
the last presentation of the day. So everybody get some rest. Thank you.
Let's back on it tomorrow.
Everybody though. Tomorrow we have more great ones. There's a graduate student panel. There's an alumni panel. There's a Theta Chi Sigma panel, and as always, there's a ton of presentations that are sure to be well done. So see you tomorrow, everyone.
Bye.